We're going to talk briefly about the three arches of the foot. So the bones and ligaments in the foot and ankle form and maintain these arches. You have two longitudinal arches, so from heel to toe. You have the medial longitudinal arch, which goes from the calcaneus to the talus navicular, three cuneiforms, and then the three medial metatarsals. It's also called like your instep in colloquial terms. Then you have your lateral arch, longitudinal arch, which extends from the calcaneus to the cuboid to the fourth and fifth metatarsals. And these may be high, medium, or low. There's a lot of debate about what high arch, low arch means, but if they're functioning properly, you should have no problems. Then we have the transverse arch, right? So this is across the foot. And this separates your rear foot motion from your forefoot motion so you can have independent movement. We can look at how the body weight affects those motions. So you can see if you have a collapsed arch, which is this bottom, that's a pes planus. Something is not working in between the arch and the plantar fascia, which is at the bottom of your foot, this spring. And so it can also result in plantar fasciitis. So let's look at a little deeper into plantar fasciitis. Anything with itis is an inflammation, and this is an inflammation of the plantar fascia of your foot. So it's a very stiff, strong ligament on the bottom of your foot. The medial longitudinal arch, which we talked about briefly, is a shock absorption structure of the foot. The height of the arch is supported by the ligaments, the bones of the tarsals, and the plantar fascia. Active muscle forces do not support the arch while standing. But during foot contact, the ankle and the subtalar joint go into pronation, as was discussed in a previous video. The foot basically adapts to the surface. So you can imagine when we were running around barefoot, you want to adapt to the surface. The arch is slowly lowered to the ground. And that's, quote, called the shock absorption phase. Now, during push off, the ankle and the subtalar joints supinate, so the arch rises and becomes rigid. It converts the foot into a more stable structure because you always want to push off a stable structure. And then there's something called the windlass mechanism. So when your great toe or your hallux goes into extension, that also affects your arch. And I'll link this YouTube video to this playlist. If there's a problem, an overstretched or a weak plantar fascia, you can have pes planus, as we saw previously. So this looks like a flattened arch, right? So you can see a nice foot shape, and then the flat arch on the bottom. When you overpronate, for whatever that is for an individual, you may start to stretch this plantar fascia, and depending on the intrinsic muscles of the foot, you may or may not be able to support that arch. With running and jumping, during the push-off phase, the ankle plantar flexes, results in the toes going into extension, which places a load on the plantar fascia. So if a runner has pes planus and is constantly loading that plantar fascia, that could result in the injury. So plantar fasciitis is a repetitive strain injury or an overuse injury.